on items not on the agenda? All right, seeing none, we'll jump into Road Court with Landy.
All right. Well, good morning. Thank you. Before the board is a request that you approve the action to accept the Montana Department of Transportation Highway Safety Grant in the amount of $118,329. This is the third year in a row we've received this grant from Montana Department of Transportation. It solely funds our road court, which is our DUI treatment and accountability court. And I am happy to say that the program it takes about a year, a little bit longer for a participant to graduate and move through the phases. We have had to date 7 graduations. They have all been virtual, which has been an interesting aspect. But there is not going to be a fiscal impact to the county. This is just money received from the Department of Transportation and dispersed to fund the program. Any questions?
That's great. Super good.
Yeah, thanks.
And
yeah.
Congratulations on you are awarded an increase, or?
It is an increase, yes. We're hoping to increase participants from 20 up to 30. We also have a pending federal grant to expand and bring in municipal court, but have not heard on that yet to see. So it is an increase this year.
Landy, how do people is it a program people will sign up for, or do you offer it to them as an option? How does it work?
So it is an option for misdemeanor DUIs, high BAC, high blood alcohol content, or repeat DUI. So primarily your second and third offenders. Sometimes there's an occasional traffic-related alcohol offense that doesn't come in through a DUI that can be screened. But we screen the participants. They have to be a high risk, high needs, and have a substance abuse disorder. And then there's always that caveat that they have to want to do the program. Part of the incentive to doing the program is that 70% of their fines will be waived and all of their jail time. And so that's significant. And I think that's significant to, the county costs. On a third DUI, there is a mandatory of 30 days of jail time. So attorneys make a referral, judges can make a referral to the road court coordinator, and then she'll do the screening process.
And you're saying you've had to cap it at 20 in the past and you're looking to expand?
Yes, we have. And part of that was to get the program up and doing it well with regards to best practices, and also with the capacity, because part of the funds go to pay for chemical dependency treatment to make sure that we have a good continuity of care and can get people into treatment. And that also means that their treatment provider is part of a team. There is a road court team that includes a defense attorney, a prosecutor, a misdemeanor probation officer from Missoula Correctional Services, and then we have a contracted defense attorney, and then we have the road court coordinator, which is Miss Sam Arcan, and then myself. And then we also have a representative from law enforcement. Highway Patrol has gone above and beyond to be a part of the program and support the program, and that's through Sergeant Sean Finley.
Great, it's good.
Yeah,
team.
Thanks so much, and I think this is, of course, I'm a little biased, but I think this is totally newsworthy and really demonstrates that we are Missoula County striving to do more than just be punitive when it comes to the criminal justice system, and really try to help people out at a most basic level as far as what their problems and challenges are.
Well, and I agree with you, Dave, and it's on my to-do list that I need to move it up and to do a press release for this grant again. So thank you for that gentle encouragement, which you probably didn't even know you just did.
I was thinking a similar thing. This is innovative and shows that we're thinking about prevention, not just reacting. So it's great.
I do think we have Martin Kidson on the meeting. If you have any questions for Landy, Martin, on this.
I hear you guys. I think we're pretty good. Thanks, Landy.
All right. Thanks, Martin.
Well, I would move that we approve the grant contract.
Second.
Right. All in favor?
Aye.
Aye.
Thank you.
Thanks, Landy.
Thank you.
Thank you.
All right, Chris, we have a renewable contract. I'm not sure who this Dory person is, but.
So thanks, commissioners. So this is an extension of the employment agreement that you have with Dory Brownlow, who works on our TIF districts. As you know, there's some good work happening there. Yesterday, we had the contingent sale of some property out in the development park, also one of the areas that Dory helps us out with. And then, of course, they're exploring a TIF out in the area just to the west of the Y. So this is an extension through the end of the fiscal year for her contract, bringing us out from an end date in early December to June 30th of 2021.
And I would be remiss not to mention that Dory has also been helping with the establishment of the Big Sky Passenger Rail Authority. So
that is a good point.
Multitask.
Yeah.
Many projects.
Yeah. No, Dory's done a great job, and I'm glad that she'll be with us for till the end of the fiscal year.
We have lots of projects to put bows on. So I move to approve an extension to the employment agreement for Dory.
Second.
All right, all in favor?
Aye.
Aye.
Okay. Thanks, Chris.
Thank you.
Thank you.
Kayla, do you want to work through these, kind of give us a little rundown on all of them, and then we'll vote all at once?
Yeah, that's perfect. I was just about to ask you guys that, so thank you. So I have the next several agenda items, number 3 through 7, and they are contracts that were earmarked in the FY21 budget that would be funded through the Substance Abuse Prevention Mill Levy. And just as a background, the mill levy was approved by Missoula voters in 2008 to provide supporting prevention programs in Missoula to aim at growing healthy youth and families and reduce the negative consequences of substance use. There's a total of $368,920 available every year through this permanent levy. So to jump into the contracts, item number 3 is a contract with Mountain Home Montana for $13,301, and this will support their residential and outpatient programs for pregnant and parenting young women. Item number 4 is for the Boys and Girls Club of Missoula County for an amount of $10,000, and this would support their implementation of their after-school and summer programs that provide a safe drug and alcohol-free place for youth ages 5 through 13. Item number 5 is with City Life Community Center for $15,000, and this would support their After Dark prevention program for teens, and they provide fun, safe activities on Friday and Saturday evenings, and this is the only program aimed at teenagers in Missoula. And then item number 6 is with Empower Montana for $8,000 to support their EPIC after school program, and this is for middle school youth, and to address the effects of bullying through age-appropriate programming that provides trauma-informed leadership and resiliency skills building, and that is to also prevent after effects of bullying, which could lead to substance use. And then lastly, number 7 is a contract with Western Montana Mental Health Center for their Project Success program. And this is individualized counseling for high school students, parents, and teachers, as well as school-wide substance use prevention activities that are aimed at high schools. So any questions on any of those several contracts?
We have 8, right? Is that?
We have 8. There's only 5 today, but I will be presenting the remainder at a later date.
Okay.
Yeah, this all sounds like great work. So I will move that we approve items 3 through 7.
Second.
Hey, all in favor?
Aye.
Aye.
Thanks a lot, Kayla, for doing all this.
Yeah, thank you.
Thank you.
Okay, we have a ghost presenter to speak on a standard employment contract, an agreement at PHC.
So, hi, Commissioners. It's me pitch hitting for PHC here. So this is 2 extensions for existing providers at Partnership Health Center in the next 2 items. One is Dr. Sarah Potts. She came on as their behavioral health specialist. So she oversees their behavioral health program at Partnership Health Center. And then you have an extension for the contract with Dr. Kresbaugh, who serves as one of the medical directors at Partnership. This extends the length of their contract and adjusts their pay rates to the new matrix. As you'll recall, Partnership does a pay study that compares federally qualified health centers in the state of Montana as well as other health centers across the United States, and has a system that they use, a chart that they use specifically to place medical providers. And so this keeps them in line for those 2 high-level positions at Partnership.
Thanks.
I don't have any questions or comments, so I move to approve items 8 and 9.
Excellent. Great. All in favor?
Aye.
All right. Thank you.
Thank you.
Chris, you want to talk us through this next piece of correspondence?
I actually think Kristen is here to talk.
Oh, wonderful. Okay. Sorry, Kristen.
Good morning, Commissioners. Yeah, so I am going to talk through this one. This is a letter template that's here for your approval. And this letter template is to invite members of our criminal justice community to be a part of a steering committee to oversee a pretrial research project that we are conducting. The idea of the pretrial research project came from a strategic planning session that was done by our CJCC earlier this year. And so the idea is that we're going to have a steering committee that's going to oversee the project, define the scope, and pick a consultant. This letter template is that letter to invite folks to be a member of that steering committee. This project will be at no cost to the county because of our receipt of a MacArthur grant. We have access to a nationwide panel of pre-trial experts, and so we're going to be able to choose from this network to get a consultant to come in and conduct this research at no cost to the county. And yeah, that's kind of the gist of it. Are there any questions about this template or the project in general?
A timeline, or is that in here?
Yeah, actually, there is not a timeline in the template, but what we're looking at is sending, after this letter is approved, we're going to send it out to members of the steering committee, and hopefully have our first meeting in October where they're going to define the scope and pick one of the consultants, and then we're going to set the consultant to work. And the steering committee will meet maybe one more time during the research project, but definitely one more time at the end to look over the recommendations that are made by the consultant to follow up on.
Yeah. Only thing I kind of want to reiterate to media and others on this call is that though Kristen and the CJCC are staffing this and making this happen, this as a project is really coming out of our office.
A commissioner-led initiative.
This is a commissioner-led initiative. I just want to be clear on that.
Thanks for clarifying.
Yeah,
yes.
No worries.
And glad you're leading, Josh.
Let's come around via DocuSign. Is that the? I'm assuming.
Oh.
These letters.
The letters.
Yeah, I'm sorry. I'm not sure. I'm assuming yes.
Okay. We'll look for it.
Okay. Maybe Annie can help with that. But
here today.
Yeah, great. Wow, we can actually get real signatures today.
Right.
No, it's kind of amazing.
Excellent. Yeah, so I'll make sure that gets around to you all to sign. Thank you.
Great.
Okay.
Thanks a lot.
Thank you.
Okay, in terms of discussion here, do we have any communications needs, requests, comments, or instructions?
I don't have anything for you guys today.
Thanks, Allison.
Thank you.
Hey, I think you might be aware of it already, but I received a message yesterday from, of all places, Granite County, wondering if they could learn more about the rail authority. After a little.
Still too long.
5 months, I understand. So anyway, I'm going to meet with them next week, and maybe we have a few more dots. So
that's really great. More is better. Go Granite County.
Yeah.
That's great.
Yeah. All right, do we have anything else there?
Hey,
Adrian?
Josh, can I just ask, is that pre-trial thing, is that part of your jail diversion plan at all? Are they kind of intermingled, or is it a separate issue?
Yeah. I mean, I guess in the grand scope of jail diversion, they are intermingled, but this was not identified in the jail diversion plan per se.
Okay, thanks.
You bet. And Martin, if you want to talk more about this after the call, I'm excited to.
Okay, I'll re-listen to the tape and see what's on it and maybe follow up.
Yeah, please just let me know if you want to chat more about it.
Thank you.
Adrian, you want to talk to us on COVID, wildfires, et cetera?
Sure, you bet. So I'll start with wildfires because as Juanita pointed out, it was raining this morning, and so we're continuing to see our fire danger kind of incrementally go down. We're currently sitting in high fire danger, but I expect that by next week we may see that drop down to moderate. Air quality continues to be good, and so we're hoping for that, though we do expect to see a little bit of a warm up next week. So we're not quite out of the woods yet, but we're getting closer by the day. COVID-19, I think you guys are pretty well versed in what's going on in Missoula County and kind of our increase in cases. We continue to support the health department. We recently took delivery of a state PPE, personal protective equipment cache that is being stored out at the Record Center. That is a state asset, but it was kind of pre-positioned into Missoula County for Missoula County's use with some caveats because we don't necessarily own it, but hoping to be a little bit more nimble should we experience shortages like we did early on in the outbreak. So we're excited about that. I think you all are aware that we did receive a request from the state of Montana Disaster and Emergency Services and the governor's task force late last week to utilize our Type 3 incident management team housed here out of our office. It's a multi-agency team comprised of individuals from fire, law enforcement, and obviously the Office of Emergency Management. We've utilized this team many times over the years to manage our own disasters, as well as we've sent this team out to assist other communities within kind of western Montana, primarily around wildfire response. But about 2 years ago, we did send this team down to Liberty County, Florida, following Hurricane Michael to help that county in their EOC operations and kind of get themselves stood back up. So when the request came in on Friday to assist the Northern Cheyenne Reservation and Tribe amid their COVID outbreak, we were more than happy to try to figure out how we could support that operation. Essentially, we sent over what we call a short team, which is we sent over 9 individuals to assist with their tribal government in establishing kind of their EOC continuity of operations, as well as continuity of tribal government operations amid their they have so many of their people that are either infected or in isolation and quarantine that they're unable to provide some of those basic services. And so really the role of our team going over there is not to run tribal government or anything like that, but is really to be that coordinating entity and to help them kind of get their legs under them so that they can stand back up when they're done with this phase of COVID.
Adrian, I suspect that there could perhaps be Missoula County community organizations or individuals who might want to assist in some capacity with the challenges that they're facing over there on Northern Cheyenne and in Rosebud County. Will our incident management team be pulling together any COAD type structure, or how would we know how additionally folks who want to help might be able to help?
Sure. You know, the team deployed yesterday morning. I did have contact with them late yesterday evening. They were just kind of getting on scene, and in order to I'll elaborate on that just a little bit. In order to kind of account for their health and safety, they're doing some things different than we typically would do, and that we're kind of putting them up in RVs rather than in hotels, as well as trying to honor some of the requests that were made for this deployment and that we don't bring additional complexity to the situation over there. So we're isolating the team and trying to have them be as effective as they can kind of from the fringe so that they're not being too disruptive over there. But that being said, they are working for and at the direction of the tribal council and their health department. And so they will engage at whatever level the officials over there want them to. Nick Holloway from my office is very adept at establishing COADs and having them plug in where they can be most effective. And so I'm confident that if there is an opportunity to do that, that he will seize upon that, as well as once they get there and kind of have a better sense of what the needs are. Certainly we can be in communication to see if we can amplify some of those needs. And if there's anything that we can do in Western Montana to support that, we're happy to do that.
That's great to hear.
Thanks.
All right, do we have anything else?
Not for me, but we'll wait for the next. We just got the report from the National Weather Service that we're expecting a colder, snowier winter. So
hey, wonderful.
What that brings.
That's good news. I like that.
In some ways, yeah.
Yeah. As a skier and outdoor hockey player, I'm thinking. Good. All right. Well, thanks everybody, and thanks for coming, Martin, and whatever other members of the media. And we'll see you soon.
Bye.
Bye.
Thanks.